All right, so you're welcome. We are now going to look at cranial nerves. So in the previous discussion, we looked at the diencephalon as well as the brain stem. So the diencephalon, we are saying this is a part of the brain that develops together with the cerebrum. So it is always embedded between the two cerebral hemispheres. So roughly the parts of the diencephalon involve the following: the thalamus, the hypothalamus, the epithalamus, and the subthalamus. And we're saying this is a major pathway, or you can call it the gateway to the cerebral hemispheres, or gateway to the cortex. So it serves as the highway to the cortex. So you know that the highway has two, traffic routes, one facing north, one facing south. So in this case, the route facing north or up will be the sensory nerves, or what you can refer to as ascending nerves. The route facing south or descending, we can call it the motor route. So that would channel motor impulses from the cortex to the stem of the brain and finally to the spinal cord. Away from that and focusing on today's session. So in total, we have 12 pairs of cranial nerves. We are calling them pairs because each of a single nerve has two branches, one on the left side of the brain, the other one on the right side of the brain. So this is one hemisphere of the brain, that is another. Then this is a longitudinal cerebral fissure, separating the left hemisphere from the right hemisphere. So you see that this is a first cranial nerve, and it will have the left and the right branch. So that's why they are in pairs. Okay, but the function still remains the same, except that each one of them would be supplying the side of the body in which it is going. Like this one, if it's on the left, it will go and supply the left part of the body. Now, cranial nerves are part of peripheral nervous system. In addition, they belong to the part of the peripheral nervous system known as autonomic nervous system. Further, cranial nerves belong to a portion of the autonomic nervous system referred to as the parasympathetic nervous system. Parasympathetic nervous system. Okay. So cranial nerves supply structures and organs and tissues found in the following regions. Number one is the head region. Number two is the neck region. Number three is the chest or thoracic region. And finally, the abdominal region. So you see that some of these nerves, even though they are originating from the portions of the brain, you find them wandering all the way into the abdomen. One particular example is the vagus nerve. That is the vagus nerve there. All right. That's why it's called vagus, because it is wandering. And it's supplying structures in almost all of these regions we have mentioned. Now, cranial nerves perform the following functions, right? So a cranial nerve can carry motor as well as sensory signals or impulses, if you like. So it will be involved in transporting impulses to the brain. At the same time, it will be involved in transporting impulses from the brain towards that organ it supplies. Okay. So this time now, we'll be calling those stimulus or impulses as modalities. So we have sensory modalities as well as motor modality. Now remember that motor modality will bring about effect or changes in various body organs. Okay, so either if it's a motor modality, either it will command some muscles to contract, or it will command some glands to secrete something. Okay, if it's a sensory modality, then it is picking up various stimulus in form of sensation. For example, sense of taste, sense of smell, sense of touch, pressure, and so on. That information is being picked either from the muscle, either the gland, teeth, skin, and so on and so forth, and taking that information to the brain. So at any given time, a cranial nerve, just like a spinal nerve in the previous discussion, is a mixed nerve. Very few actually are purely sensory and purely motor. So such kind of cranial nerves will only carry one modality. If it's a pure motor nerve, its function is just to command motor action, for example, contraction of a certain muscle. If it's a sensory nerve, if it's a purely sensory nerve, then its function is to carry only impulses towards the brain. It will not carry command from the brain to the body part. Okay. One such example is the first nerve itself, cranial nerve number 1. This is olfactory nerve. Similarly, cranial nerve number 2. These are special, purely sensory nerves. They will carry information to the brain, and therefore they are sensory nerves, and they are carrying only sensory modality. So here we have a total of all 12 cranial nerves. Okay, this is an image gotten from Gray's Anatomy flashcard for students. Okay, so these are essential in the sense that they help you to remember and master some of these structures. So here the labels are removed, only you have numbers. So follow me as I guide you through the following. Number 1, this is cranial nerve number 1, otherwise known as cranial nerve or olfactory nerve. Olfactory meaning sense of smell. This is optic nerve. So they are paired, left and right. Or cranial nerve number 2. This is cranial nerve number 3. Cranial nerve number 4. Or what we can say, trochlear nerve. Cranial nerve number 5, trigeminal nerve. Of course, this nerve has dual modality. It has a motor part and a sensory part. That smaller one carries sensory inputs. This larger one carries motor modality. Regardless, to say cranial nerve number 5 is the largest cranial nerve in the human body, trigeminal nerve. Then this is cranial nerve number 6, or otherwise known as abducens nerve. Abducens nerve. Cranial nerve number 7. So 6, 7. Cranial nerve number 8. Cranial nerve number 9. Cranial nerve number 10, or vagus nerve. Then we have cranial nerve number 11, and finally, cranial nerve number 12, or what we can call accessory nerve. So before I even go any further, I want you to note that cranial nerve number 1, cranial nerve number 2 are connected to the telencephalon. Cranial nerve number 1, cranial nerve number 2, connected to the telencephalon. That is a cerebrum, to be specific. Cranial nerve number 3, or oculomotor nerve, and cranial nerve number 4, trochlear nerve. These two again are connected to the midbrain. So saying 1 and 2, cerebrum. 3 and 4, midbrain. Okay. Then the remainder are connected to the pons and medulla oblongata. Okay. So this is 3 and 4. Then we go to 5, 6, 7, 8. These have to do with the pons. 5, 6, 7, 8. Pons. 9, 10, 11, 12, medulla oblongata. I'll repeat again. 1 and 2, cerebrum or forebrain if you like. Okay. Next is 3 and 4, midbrain. 5, 6, 7, 8. That is pons. 9, 10, 11, 12, medulla oblongata. All right. So these I've explained already. Let's just quickly go into one of them. So here is a list of them and their functions. So in your own free time, I would like you to sit down and work out these functions and attach them to each individual nerve, so that at any particular time you could be able to describe the nerve and its function. So here is an acronym that can help you to remember these cranial nerves. So on Old Olympus, towering top, a French and German viewed a hope. So I don't know if you're into that, using acronyms to remember things and improve your memory, then you have something to work with. Okay. Now let's quickly go into the discussion. So cranial nerve number 1, otherwise known as olfactory nerve. So in most cases, we'll just be saying CN1, meaning cranial nerve number 1, but you should be able to know the alternative name. Okay, so this is a nasal cavity, that is the oral cavity. Here is a palate, of course, hard palate, soft palate. These are the conchae or turbinate bones, superior, middle, and inferior. Now, if you remember the discussion we had in the respiratory system, especially histology, we are saying on the superior nasal conchae, you find a special type of epithelium known as olfactory epithelium, different from respiratory epithelium. Olfactory epithelium is different in the sense as it has sensory nerves. Now, these sensory nerves collect their axons just above the nasal cavity. So that is the ethmoid bone. Now, ethmoid bone has what we call cribriform plate. Cribriform plate, that's the spelling there. Cribriform plate. Now, this cribriform plate has small perforations, as you can see there. So it allows axons, because the cell bodies will be here, allows axons to pass through this bone and enter the skull. So this bone is not completely solid, it is spongy with a lot of spaces. Okay, so that axon can pass through. So that is a ethmoid bone separating nose from cranial cavity. That is cranial cavity where the brain will be. Now, in the cranial cavity, these axons merge to form what we call olfactory bulb. It is from the olfactory bulb that olfactory nerve will emerge. So that is olfactory bulb, that is olfactory nerve going to the forebrain. Okay. So that's why usually in patients, when you have, rhinitis, inflammation and infection of the nasal cavity, usually you have headache, because whatever viral infection is causing inflammation there easily spreads to the brain. So to pass through the nerves and follow the nerve all the way into the brain tissue like that. Okay. What is the function of this nerve? It's olfaction, sense of smell. So this is the only nerve we have in the human body that enables us or gives us the ability to smell various types of odor in the air that we inspire. There is no any other nerve that can give us that function. So damage to this nerve, then there and then sense of smell is lost. Condition known as anosmia. Okay. Let's look at cranial nerve number 2, otherwise known as olfactory optic nerve. So the first one is olfactory nerve, now is optic nerve. So when you hear the word optic, usually what comes to your mind is vision, lenses, and so on and so forth. So the same applies. So this is a nerve that carries impulses for vision, gives us the ability to see. And therefore, there's no any other nerve in the human body that can give us this ability. Equally, damage to this nerve may cause blindness. Okay, either bilateral or unilateral. Okay, if it's unilateral, then the image that will be seeing might be distorted in one sense or the other, or the acuity will be poor, right? Now, we have two eyes, meaning we're going to have two olfactory optic nerve, one for each eye. Now, these nerves send a small branch that will meet and cross to the other side. So an olfactory nerve like that will send one of its branches to the right side if it was starting from the left side of the eye. So a branch goes. So at the end of the day, the image that we see is shared between the two eyes that we have. So the origin of this nerve is from the retina. That is the retina. Okay. Retina. And there are different types of cells there that gives us the ability to discriminate light and also identify the color in the light that we are seeing. Okay, so we have rods and cone cells and different other type of cells. So we'll discuss more about the eye when we start looking at special senses. So from the eye, the axons from the retina converge there to form the optic nerve. So you see optic nerve, then these are axons coming from the rods and cone cells there. So that is the retina, that is optic nerve, optic nerve. Now, see that the optic nerve projects, or rather sends signals to the part of the cerebrum, the occipital lobe of the cerebrum. This is the posterior part of the cerebrum. And we said Brodmann area 17, Brodmann area 18 and 19, those are visual areas because that's where we interpret images from. Okay. Right. So we look at cranial nerve number 3. So cranial nerve number 3, otherwise known as oculomotor nerve. So this nerve is coming from the eye socket, right? Now, from the eye socket, this muscle goes to the brain. So from the midbrain, it's originating from the midbrain and then projecting to the eyeball. So we're saying it enters the eyeball via the superior orbital fissure, and we'll discuss these foramen of the skull when we start looking at the skeleton. Okay, so that's our nerve there, oculomotor nerve, supplying most of the muscles in the eye. So this is a purely motor nerve. So it enables us to move the eye and at the same time constrict the pupil. Right. So size of the pupil will be controlled by the oculomotor nerve. So majority of the muscles in the eye are commanded by the oculomotor nerve. So optic nerve has nothing to do with eye movement, but just to interpret or carry impulses to the brain so that you can know what you are seeing. But now to move the eye sideways, up and down, is other nerves. So you can see oculomotor nerve is controlling most of these muscles, 1, 2, 3, 4, 5. All of them being controlled by a single nerve. All right. And this is the movement that occurs when those muscles are commanded by the oculomotor nerve. Number 1, for example, adduction of the eye. Remember, adduction is movement of the eye away from the midline. Okay, now usually movement of the eye is synchronized. All right. So if you want to look to the left, even the right eye will follow the left eye. So if you're abducting the right eye, then the left eye is adducting because it's coordinated like that, right? So it's very difficult to adduct or abduct the eyes at the same time. Like you make your eyes look as if they're liking to look at each other. That is adduction. bilateral adduction. Usually it's singular, like this eye. It's looking in the midline, so that is adduction. But this one is looking away. The midline is here. This one is looking away. Okay. So what is controlling this eye to look here is that muscle, of course, commanded by oculomotor nerve. In addition to that, the oculomotor nerve also controls the upper eyelid, or what we can say the palpebral muscle. So this is a palpebra, the eyelid itself. There is a muscle inside there that enables us to lift the eyelid. Now, sometimes coordination between this nerve, the oculomotor nerve, and the muscle is weak. And then individuals develop what we call ptosis, or drooping eyelids. So at any particular time, this individual looks like they are dozing. It's because the eyelid cannot lift adequately. So this person is actually maybe even staring, but the eyelid cannot lift beyond that. Okay, it's also common in patients with Horner's syndrome, where the eyelid cannot lift up. We go to cranial nerve number 4. Okay, cranial nerve number 4, similar with cranial nerve number 3. All of them originate from the brainstem. Okay, so cranial nerve number 4, we call it trochlear nerve. Trochlear nerve, equally this nerve goes to the eye. Okay, it's a nerve that goes to the eye. So already you've seen that cranial nerve number 2, cranial nerve number 3, cranial nerve number 4, they are going to the eye. So the eye is highly supplied with cranial nerve. That's not all. We are still having some more that goes there. Now, this nerve is important, or is special, because it already decussates within the midbrain, okay, and then exit from there on its dorsal surface, okay. So think of it in the following manner. This nerve we are seeing here, that is cranial nerve number 4. It originated from this side of the brainstem, of the midbrain. So yeah, midbrain or brainstem. To be specific, is midbrain. So it originates from there, but comes out on the other side. Equally, this one, its origin is this side, but comes out on the other side. So as they are moving from this side to the other end, they cross each other. So that is called decussation. So this one is origin is on the opposite side. That one origin is on the opposite side. So that's what we call decussation. And then its origin, or it come out of the brainstem from the posterior side. So it encircles the midbrain. It's the only cranial nerve that wraps around the midbrain. So it's easy to identify. If you examine the midbrain, you see a nerve, more like encircling it. That is trochlear nerve. Equally, it goes to supply the eye. Okay. Right. So its functions, number 1 is depression, intorsion, and abduction of the eye. Okay. So when those actions occur on the eye, especially intorsion and abduction, what will happen is that the gaze will be in this fashion, looking down and outwards, down and outwards. This is normal position, but you look down and outwards. It's because of this cranial nerve number 4, otherwise known as trochlear nerve. So it's commanding muscles that control the eye movement to look in that direction, okay, without moving your head. Cranial nerve number 5. Now, cranial nerve number 5 is the first nerve of the pons. So it's the first nerve that arises from the pons, and you will not miss it. Saying this is the largest nerve, largest cranial nerve. Now, cranial nerve number 5 has 2 parts. So it has the motor one, like a smaller one there you're seeing inside, that one. That's the sensory one, sorry. That's the sensory one. Then the motor one is the largest. So that's a motor, and that is the sensory one. So the sensory one will only carry sensory modalities, meaning it is picking up sensation from the face. So all this skin in the face, pressure, touch, prick, whatever, that feeling is being taken or transported to the brain by this sensory part of cranial nerve number 5, otherwise known as trigeminal nerve. Okay. Now, there are muscles in the face that help us to chew. So we call those as muscles of mastication or muscles of chewing. Okay, so that ability to crunch down on food is because of the motor part of the trigeminal nerve, that big muscle, that big nerve we are seeing there. That is the trigeminal nerve. So in here, that nerve divides into 3 branches. Okay. As it is about to exit the skull, it gives us 3 branches. So one branch goes to the region of the eye there and supply muscles of mastication that are found in that region. So we call this as the ophthalmic branch in red. Ophthalmic because it's closer to the eye. Another branch supplies this area. Okay. Now, this bone here is a maxilla bone. So it's given as maxillary branch in blue. Then finally, another branch goes to the mandible, the lower jaw, if you like. There are muscles around this region. So we call this as the mandibular branch. So in some other words, they'll just give them numbers. So the first branch is cranial nerve number 5, division 1. Cranial nerve number 5, division or branch 2. Cranial nerve number 5, division or branch 3. So you're seeing CV1, cranial nerve number 5, 2, and cranial nerve number 5, 3. Sorry, here saying cranial nerve number 6. This is a mistake. It's cranial nerve number 5, 2. So I think I'll correct that one when okay, let me just quickly do it so that we don't get information mixed up. All right, so that's cranial nerve number 5, second branch, maxillary. Okay. So that is the largest cranial nerve we have in the body. And these are the muscles of mastication. I'll just give some few examples. This is temporalis muscle, and this is the masseter muscle, the common masseter muscle. Then that is the bassineter muscle, one of the largest groups, bassineter, masseter, and temporalis muscle. Okay, so these are very powerful muscles that enables us to crunch down on food. Okay, but in various animals who are advanced in this area, for example, a hyena, a crocodile, and the rest, they are very powerful and massive muscles in this region. Okay, and that's why they can even crush bones. So the biting force would be way enormous than the human one because of the bulk of the muscles and maybe the arrangement of the skull itself. Okay, but anyway, the control will be the same. It will be the cranial nerve number 5, trigeminal nerve, to be specific, the motor branch. Okay, we go to abducens. That is the second muscle to second cranial nerve to arise from the pons. Cranial nerve number 6 or abducens nerve. So this one is going to the eye. All right, it's going to the eye. So we said cranial nerve number 2, cranial nerve number 3, cranial nerve number 4 to the eye. We skip 5, we go to 6, back to the eye. Okay. So what is the function? Is mainly abduction of the eye. Okay. To look away from the midline. This is normal position. You are facing forward. This eye will look away. This eye is looking away. Now, in that fashion, so what is controlling this is abducens, but what is controlling that is totally different. Okay. Adduction, we said that is oculomotor. So oculomotor, then this is abducens. Then down and out, we said that is trochlear nerve. Right. Next is facial nerve. Cranial nerve number 7. So that is cranial nerve number 3, oculomotor. 4, trigeminal, abducens. Now we are here. Cranial nerve number 7, or what you can call facial nerve. So facial nerve emerges from the lower border of the pons. Anyway, still pons. That is pons. Facial nerve. Okay. So function number 1 is that it also involves in muscles of the face. So this is a nerve that enables us to make different expressions in our face. So those muscles have nothing to do with chewing, but rather facial expressions. For example, frowning, smiling, all those is because of facial nerve. So if there's any damage to the facial nerve, you see that the face will be pulled in one direction, where the nerve is weaker, where the nerve is functional. So if facial nerve, for example, on the left is damaged, then my face will be pulled to the right because muscles here become paralyzed. But here they are functional, so they will pull in that direction. Okay. So in addition to that, facial nerve also sends a sensory branch to the tongue and enables us to taste food. So apart from facial expression, it is also involved in picking up sensation of, taste from the tongue, especially the anterior part of the tongue. All right. So that is your nerve there. Cranial nerve number 7. Cranial nerve number 7. Facial nerve. Or facial expression. Okay. Now, cranial nerve also has branches. So it has 5 branches. Trigeminal, we said we have 3 branches. Ophthalmic branch, maxillary branch, and mandibular branch. Okay. Now, facial nerve has 5 branches. So that is the nerve itself. It is easy to identify because this nerve passes through the parotid gland. So it has nothing to do with the parotid gland, but it passes right through it, not beneath it, not on top of it, but through it. Okay, and that's why maybe there's so much pain if a child or maybe an adult has a condition known as epidemic parotitis, which is mumps disease. Usually the parotid gland swells because it is inflamed by the mumps virus, and that causes compression on this nerve and causes serious pain in such individuals. Mumps are very painful, okay, mainly because of the nerve that is passing through. You said facial nerve, of course, it is a motor nerve because it is controlling these muscles in the face to give us various expressions, smiling, frowning, and so on. At the same time, it sends some branches to the tongue. Those branches are now sensory because they are getting sense of taste from the anterior portion of the tongue. So they are termed as followed. So we have the cervical branch. Now, cervical branch of the facial nerve supplies part of the area of the body that is behind the ear. The ear will be here. Okay. So it will be sending motor branches to these muscles. So, for example, posterior auricular nerve, then we also have nerve to the digastric muscles and the styrohyoid muscles. This is a muscle of chewing. Okay. Muscle of swallowing, sorry. Styrohyoid is for swallowing. So this one and this one, we call these as cervical branches, right? All right. Sorry for that. So first branch is called temporal branch. So that is temporal branch. Branch number 2 is zygomatic branch because the zygomatic bone is just there. The next, we have the buccal branch. So buccal branch is around this region. Then we have marginal branch just in the line of the lower jaw. Then we have cervical branch that goes to the neck. Cervical branch. Okay, so cervical branch, marginal branch, buccal branch, zygomatic branch, and temporal branch. So temporal, zygomatic, buccal, marginal, and cervical. 5 branches. Next, we go to cranial nerve number 8, known as vestibulocochlear nerve. So vestibulocochlear nerve is a hybrid cranial nerve because it has 2 nerves in it. Nerve for balance and nerve for hearing. So this nerve is coming from the vestibular. So this vestibular structure is found in the ear. Okay, there's fluid in this structure where it helps us to be aware of the position of the head in space. Okay, then there's cochlear nerve. This is a nerve that is connected to the cochlea itself. So it goes to the brain as auditory nerve for sense of hearing. And you and I know that Brodmann area 41, Brodmann area 42, that is a primary auditory area, specifically for interpretation of sound. Okay, so that is a nerve. Okay, cochlear nerve, and then we have vestibular nerve. Okay, vestibular nerve, cochlear nerve, and then together termed as cranial nerve number 8 or simply vestibulocochlear nerve. That's the nerve here, this one. Facial nerve, then that is vestibular nerve or cranial nerve number 8. Okay. So vestibular, I was saying, is balance, and then cochlear nerve is hearing. Okay, so 2 functions there. Next is cranial nerve number 9. Cranial nerve number 9 is right here, or otherwise known as glossopharyngeal nerve. Glossopharyngeal. Glossal is tongue. Pharyngeal is a pharynx. So it will be involved in picking up sensation from the posterior side of the tongue, as well as aids in swallowing. So muscles in the pharynx should relax so that food is pushed in the pharynx, and then lift up the larynx so that we can swallow. So that is glossopharyngeal nerve or cranial nerve number 9 responsible for such. Okay. So like we are saying, it is involved in taste, salivation, and swallowing. Apart from that, it is also connected to the carotid sinus, where it maintains or monitors blood pressure, then carotid body, where it takes, various chemicals in blood, for example, carbon dioxide and oxygen. Okay. Remember, carotid body is between internal and external. Carotid. This is common carotid. This is internal. This is internal. This is external. Then what you're seeing that swelling there is carotid sinus. Equally, that is a nerve sending branches inside there. So the body is for pressure. So as blood is going in the internal carotid and external, each of them will expand. This will expand, this will expand. So it will squeeze that. So this nerve will know whether the amount of pressure in blood is adequate, or it is low, or it is too high. Then as blood is passing through the internal carotid, or as it is going towards the brain, the sinus will detect the amount of chemicals that are there. Is the blood toxic to the brain, and so on and so forth, right? So if the blood is too toxic, maybe because the kidneys are not functioning properly, we see that the patient starts to experience disturbed cerebral function. Anyway, that is the function of the glossopharyngeal nerve, or cranial nerve number 9. Cranial nerve number 10, or otherwise known as vagus nerve. So that is a vagus nerve. See those several branches there. That is vagus nerve. So each of these branches will go to various parts of the human body: neck, chest, abdomen. So they are arising from individual nuclei inside the medulla oblongata. Okay, so glossopharyngeal was the first nerve of the medulla oblongata. Okay. Then vestibulocochlear is the last nerve of the pons. Okay. So making now vagus nerve the second nerve of medulla oblongata. So what is the function? Mainly this nerve is all over, right? So it helps in swallowing, taste. It's also important to supply various structures in the neck. For example, the larynx, to give us speech, it is the vagus nerve. In the chest, you find the vagus nerve supplying the lungs, the heart, and various organs. In the abdomen is, again, all over blood vessels, glands, the spleen. So this is the nerve we are looking at. Okay, coming like that. All these branches, you can see that recurrent laryngeal nerve, recurrent. All that is coming from the vagus nerve, supplying the esophagus, stomach, pancreas, all over, everywhere in the abdomen. It's a vagus nerve. So now, vagus nerve, since we are saying cranial nerve form the parasympathetic nervous system, so in the abdomen there, it speeds up motility. So movement of the intestine will be fast. Secretion from the stomach as well will be fast. Churning will be fast. So that's why in patients who have ulcers, and it is determined that the amount of hydrochloric acid they are producing is greater, some branches of the vagus nerve are cut, or procedure known as vagotomy. So you don't cut a whole lot of it, but you cut branches going to the stomach so that you can reduce its effect on the stomach. Because apart from moving or controlling motility there, the vagus nerve is also causing secretion of hydrochloric acid. So vagotomy is essential in that case. We go to cranial nerve number 9, cranial nerve number 11, sorry, which is known as accessory nerve, right? Let me just show you quickly. Accessory nerve. So that is accessory nerve. That is accessory nerve. So now accessory nerve has two branches, a cervical one and a cranial one. So what you are seeing there, that thick cord is cervical, is originating from a portion of the spinal cord. The portion of the spinal cord that lies in the neck, and then enters back in the skull to meet with its cranial friend or brother. So that is accessory nerve, the cranial branch, and this is a spinal branch. So that's why in this diagram now is clearly shown. Okay, you can see that that is accessory nerve. Okay, accessory nerve climbs up. This is a cranial one, then this is a spinal one. So the spinal one will enter the skull. This is a foramen magnum. The opening at the base of the skull where the spinal cord, exits. So this is medulla oblongata, this is spinal cord. So this is the foramen magnum. So medulla oblongata ends at the foramen magnum. This is where the spinal cord begins from. So if you cut there, you're separating spinal cord inferior and the brain above. And this is the medulla oblongata. Okay. So that is the cervical branch or the spinal branch of accessory nerve. Then this is a cranial branch. So here they meet and then go to the neck region. So what is the function? So it has the cranial division itself innervates intrinsic muscles of the larynx. So this helps us in speech formation as we are speaking. Okay. So it supplies the larynx, the cranial one, this one goes to the larynx. Whereas the spinal one supplies muscles in the neck. Okay. That is the trapezius muscle and sternocleidomastoid muscle. So if you hold besides your neck like that, and then you look the other way, this muscle here, that is sternocleidomastoid muscle. All right. So, and then we have trapezius muscle. That is trapezius muscle. This bulk of muscle here. This one here. That is trapezius. Trapezius. Okay, then this is sternocleidomastoid. So it enables us to look sideways like that. So it's accessory nerve that does that. So it has two branches. One going to the larynx to help in speech. Then the other one goes to the muscles in the neck to help in movement of the head. Okay, so as muscles in the neck contract and relax, they move the head in that fashion. The last cranial nerve, or cranial nerve number 12, known as hypoglossal nerve. Hypoglossal, meaning inferior to the tongue. So that is the nerve. Cranial nerve number 12. Cranial nerve number 12. That is the last nerve, and it's the last nerve of the medulla oblongata. Okay. Hypoglossal nerve. So it supplies intrinsic muscles and extrinsic muscles of the tongue. Now, when discussing the digestive system, I explained the difference between intrinsic muscles and extrinsic muscles of the tongue, right? We're saying intrinsic muscles help to change the shape of the tongue. Extrinsic muscles are involved in movement of the tongue, in and out, up and down. That is extrinsic muscles. Examples of extrinsic muscle, you have geniohyoid, styloglossus, hyoglossus muscle. Okay. So that is a geniohyoid, then that is a hyoglossus, styloglossus. These are extrinsic. Then inside the tongue there, we have intrinsic muscles. We call them the vertical, superior, inferior, and horizontal muscles. So that's all about the cranial nerves. So what I want you to know, especially as students, is to be able to label these. If this diagram is given to you, you must be able to label it fully and accurately. Okay, so here the numbering is not equivalent to the name. Okay, the numbering is distorted. It's only equivalent to the name up to here, up to number 6. After that, it is distorted, right? So from 1 to 6 is accurate. So you can name, this is cranial nerve number 1, 2, 3, up to 6. Then this is 7, this is 8. That is 9, that is 10, that is 11, and this is 12. But here you see it's given 7, when actually 7 is here. So cranial nerve number 1, olfactory nerve. Cranial nerve number 2, optic nerve. Cranial nerve number 3, that is abducens oculomotor nerve. Cranial nerve number 4, trochlear nerve. Cranial nerve number 5, trigeminal nerve. Cranial nerve number 6, abducens nerve. Cranial nerve number 7, facial nerve. Cranial nerve number 8, vestibular cochlear nerve. Cranial nerve number 9, glossopharyngeal nerve. Cranial nerve number 10, vagus nerve. Cranial nerve number 11, accessory nerve. Cranial nerve number 12, hypoglossal nerve. And this is your summary in here with that acronym to help you remember that these are the cranial nerves easily. For those who work well with acronyms, as for me, it never works, so I don't bother so much about these things. What will happen is that I'll remember the acronym but forget the name of the nerve. So for me, I just go purely into knowing these nerves and then also know the functions. All right, so we can end here. So in the next discussion, we'll look at the ventricular system of the brain and formation and flow of cerebrospinal fluid. Okay. As usual, if there are any questions, you can still get to me and we can get to have some discussions around that.